Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. Absolutely delighted to be here with you this afternoon. An important discussion as we discuss climate change and health, and also touch on investments. Delighted to welcome my colleague Sam, who's joined us from the Department of Health at Vanuatu. He'll give us a real insight into what's happening regarding climate change and the islands in the Pacific Islands. Sam, delighted to welcome you. Please kindly introduce yourself to our colleagues who are watching around the world.
Thank you, Gareth. Thank you for giving me this opportunity. My name is Dr. Posikai TAPO. You can call me Sam. I work in Vanuatu Ministry of Health as the Director for Policy Planning and Corporate Services. I am also the head of the National Health Emergency Operations Center that responds to disaster and also disease outbreaks as well. So thank you very much for giving me this opportunity.
Yeah, it's a pleasure, Sam. And perhaps we'll start could you set the scene? Vanuatu has been doing a lot of work at the UN level, particularly around climate justice. Could you set the scene for people who are tuned in, who may not be familiar about what's actually happening and the work that you guys have been pioneering at the UN, just so that people can understand the sort of opportunities and actually the challenges that we face?
Yes, yeah. So basically, our islands have been really affected by climate change and all the effects of climate change as well, not only on the health sector, but also on other sectors within government and also in private sector, and mainly on people's lives. Our government, through the Ministry of Climate Change, and now headed by the Prime Minister's office, they have done initiatives. We have presented papers during COP meetings. And now we have reached the level of putting on notice to the International Court of Justice to really get an opinion from them about whether there is the opportunity for those that have contribute a lot of carbon into the atmosphere can pay some fees to those of us that are ripping up the effects of climate change, especially carbon, greenhouse gases. So if you have noticed in the international media, we have our Prime Minister has presented that to the UN early this month, and now we are just waiting for an opinion on that. Meanwhile, within government, we are trying to mobilize our resources in terms of technical assistance to start preparing in the event when there's a decision that comes out on how we can move forward on this, and also gain support from our international bilateral partners and also within the region as well.
And tell us, just paint the picture for people who are listening in. You had 2 typhoons recently in Vanuatu. Can you explain the devastation that kind of causes and the cycle of disruption for people who are listening in from a healthcare perspective? What it doesn't mean to the local population. I presume high levels of stress, there's worry. And I suppose the world needs to be prepared for this, because what happens in Vanuatu will soon happen, across the world.
Yeah, so early this year, as you rightly mentioned, we got hit by 2 Category 5 cyclones. These cyclones had a big devastation on people's lives, especially. Knowingly, 80% of our population live in the very remote rural islands, which government services to them is very limited. Most of the infrastructures, most of them built their houses from traditional materials, and during the 2 cyclones, most of the infrastructure were damaged. Most of our clinics, especially from the health sector, were damaged as well. Schools were damaged from the 2 cyclones, and people in those rural, remote areas also depend on their gardens, vegetables. So most of their gardens were also damaged during the cyclone. It has been a trend that we have been facing since. But for this year, unfortunately, we had 2 Category 5 cyclones that hit us so hard. But Vanuatu people are very resilient. We had to bounce back. You will see photos, even though people standing next to their houses so damaged, but people still smile. And we were so grateful for the international assistance as well. in terms of replacing, putting back our infrastructure, and also trying to restart by government services, especially schools, health services, and restoring people's lives again. The assistance that we got under the different bilateral partners also helped to sustain um, locals to at least have food supply for at least a month or two, so that then while waiting for um, their gardens to regrow as well. One thing that I think you have noticed, especially for us islanders, is that we depend on the sea, and during the cyclone, it had also effects on the reef as well. So most of our, most of the people could not gain access to their reefs and get fish, and also the fish poisoning part of the damage to the reef also was something that we have seen in our hospital in terms of the number of cases that admitted with sugar fish poisoning.
Yeah, I mean, I'm going to come on to that, and I know you have a presentation which you'll bring up now shortly. But I was going to ask you about the plastic pollution and what the effects that's had on the islands as well. But I'm happy. I'll share your presentation, Sam, and you can go into that. And by the way, thanks to Vanessa, who's joined us from the Nordics, and also our viewer from Austria. If you have any questions for myself or Sam, please do put it in the chat, and we'll take those. So Sam, your presentation, I've just brought it up. The floor is yours, and we're very much excited and looking forward to hearing what you have to say around climate change and health.
Yes, thank you very much, Gerard. Thank you very much for those that have joined us. So Vanuatu, is most of you all know, we are located in the South Pacific, the southwestern part of the Pacific. We have roughly about 300 going 400,000 people in population size. 80% of the population live in rural, remote areas. About a handful, 50 to 60,000 people live in the capital, which is Port Vila, and that is where the national government services are located. We have a democratic type of government in terms of the ruling party, or the party with the majority votes in parliament, makes decisions. Compared to other Commonwealth countries, other Commonwealth arrangements, they have the governor generals. We have the president. That the president makes most of the final decisions on behalf of the government. Can we go to the next slide, and I'll just run quickly.
I think you just, on your side, Sam, I think you just click on the next one.
Okay, sorry. Yeah, sorry. Background population, more than 300. We are Melanesian people. Majority of the people, as I've mentioned, and in terms of disaster risk, we rank around within the 10 of the most risk at the natural disasters, especially in the world. 45% of our GDP also comes from tourism, and it's an attraction that we also encourage more people to visit Vanuatu. In terms of our health systems, we have a policy that the government has put in place called the role delineation policy. The role delineation policy divides or separates services. So we have the tertiary services. The tertiary services cater for the National Referral Hospital in the country, where all the specialist services are provided. So that is the level of tertiary. Then we have the secondary, which is made up of mainly provincial hospitals and health centers and mini hospitals as well. Their services are delineated in a way that it doesn't really specifically provide very specialized type of services. And then we have the primary health care services, which is provided at the level of rural and remote islands. It's made up of 8 post dispensaries, some health centers. The workforce down at that level is mainly made up of community health workers. Some part of the world, they call it community health workers. Back in Vanuatu, we call them village healthcare workers, and they provide their services to the primary healthcare level. So that policy guides in terms of how we allocate resources, provide or distribute human resource, and also financing. Healthcare is mainly financed by the government revenue generated from taxation. And in terms of categorizing, is under the target for 45 healthcare workers per 10,000. We are at 32 healthcare workforce. 1 is to 10,000 doctor. 1 doctor is to 10,000 population, and that is what we have currently at. We have a large number of nurses, so that target is still something that we are trying our best to reach. In terms of diseases, yes, diabetes is something that it's becoming a big issue now in country. As I mentioned earlier, food security, rice plays a component of food security, and rice is something that is eaten very often in terms of during a cyclone when most of the vegetations are damaged, we distribute rice. And I think one of the factors, and there's more space in that area in providing, in doing research to really identify the causality between consumption of rice in Vanuatu and diabetes. But we have seen that there's an increase in diabetes, especially in the adult population. In Vanuatu, uh, ischemic heart diseases, stroke, low respiratory disease, especially for children, has been something that are common. In terms of climate change and health, through the support of WHO and UNDP and also the Ministry of Climate Change and the Ministry of Health, we have developed a profile in terms of identifying what we should do in integrating the approach of health and climate change, developing strategic plans. So for the ministry itself, and I don't have a copy, but I'm happy to share the copy later if people are interested, in terms of how we have identified key climate change areas that causes a specific or causes a effect on health, and then we have devised plan on how we would address them in the long term. So for the Ministry of Health, we developed the disaster risk reduction plan, which guides the ministry in terms of allocating our efforts in addressing climate change. And within the plan is an integrated type of approach where we combine our resources with that of the Ministry of Infrastructure and Rural Development, the Internal Affairs, also the Ministry of Lands, which caters for the Department of Water, and the Ministry of Education. So how we can consolidate all our resources and address a particular climate change issue. So for the ministry, we have already developed a plan based on the country profile with the support of WHO and UNDP. This is basically just a snapshot on what we have done so far in terms of the different type of diseases, and I will not go to them in detail. But it's a different type of disaster that we face in Vanuatu and how they have impact on health as well. And as you can see, most of them, they affect people's livestock, even infrastructures as well. So for an island that where we find it very difficult in terms of raising revenue to support our infrastructure, it is an area that we have always been trying to advocate in terms of getting external partners to provide more assistance in the space. But in the long run, as you can see, that will be still an issue for us, especially in terms of all the climate change effects on the various disasters that Vanuatu will face going forward in terms of climate change. Some of the impacts, and I've brought that up from the reports that we have got on dengue and the projections, as you can see from the modeling on your right. It shows in figure 7, it just shows what we are expecting to see in terms of dengue cases going forward through this model as we look at the emissions scenario as well. And as you can see, dengue cases will rise as we go into the future. And this is just a recent table 1 just shows a recent numbers of malaria cases in terms of what we have expected in Vanuatu, and the cases have risen in most of the provinces, and there's more increase in cases, especially when we go through a cyclone, and those cases are reported on an annual basis as well. So we are trying our best to see how we can control the numbers, as Vanuatu is one of the countries that we eliminated malaria in one of our provinces in Tafea. So this is one of the areas that we wanted to address in terms of minimizing spread of the disease. And as I mentioned earlier as well, we have seen increase in numbers of fish poisoning, Shigatere, that has affected our reefs. And when most of our people in remote areas, they depend on the reefs as well for their livelihood. So it has had an impact, especially for fish poisoning, that has affected most of our people. Um, I think that is just a snapshot on what we have put in place in terms of response. So, in the event when there is a natural disaster, effects of climate change, especially cyclone, earthquakes, tsunami, within the country, we have a mechanism through the support of the National Disaster Office under the cluster system. We have a response plan that we normally provide response, but that is only for short term and medium term. But going forward, in terms of long term, and that is one of the areas that I have reached out to Gareth to see how we can vouch for the long term sustainability of how we can prevent a spread of a disease going forward. And also put in mechanism of support to at least support our smaller islands in the Pacific to have sustainable approaches in terms of the effects of climate change on health. I think that's basically it, Jared. Just short, but I'm more than happy to take any questions or comments. Our island has been really affected, and through the support of our Prime Minister and the President, they have and the Minister of Climate Change and all the other ministers and our people as well, non-government organization, lobby groups, they have already voiced their concerns, and you have seen them in various media outlets in terms of how we want to really address this issue of climate change. If you're in a bigger city, you don't really see the impacts of climate change as well. But when you are in a smaller islands, you can see, oh, the sea level was here back then, but now the sea level is actually moving up. So we rely on vegetables, especially gardens in the sea, and the more effects of climate change, they have a big impact on not only on the sea, but also on our livelihoods as well going forward. So I'll put it as that. Thank you very much for giving me this time.
Sorry. Yeah, Vanessa's just put a comment up there in terms of giving a great insight into what's needed, and she goes into ESG and the measures that are needed for sustainable businesses and services, which you mentioned, the disruption from climate change that's felt right across the island. Perhaps now, like, we can discuss Vanuatu's vision and the future. I know you have a plan. You've got a stack of projects that you want to move forward with. I've been reading in the newspapers recently about the plans, the work that you're doing with US government and other governments around the world to support the health service. Perhaps you could share your vision, long term. We had a conversation before we came online around how as a collective, the Pacific Islands can collaborate and work on a preventative model of disease, like as we've discussed in the future. You could perhaps share that with the audience. We've got a couple of comments coming in. I'll bring some of them up as well. Just from Ursula here. Thank you for a really informative presentation and hearing about Vanuatu. I was interested in how you support population manage their long-term health conditions, diabetes, heart when there are typhoons. So that's quite a good question. We could even start with that, Sam, maybe, and then I've got a couple of more questions that have come in.
Yeah, so for the long term, I think that is one of the challenge currently within country in terms of chronic diseases. In country, we have uh, provided mainly our system doesn't have the capability to really provide specialty services for long term chronic patients. So I'll give an example for diabetes. If you have kidney problems and you need a dialysis, that is an issue that not only us but most of us in the Pacific Island, we don't have the capacity, no, we don't have the human resource to really provide that service. And as we move into that era of climate change, where most of our people, and I've mentioned it earlier, processed food, whether we like it or not, it provides us food security for the islands because the heat of the sun and after a cyclone, the after effects that um, acidity in the sea affects the fish, so we cannot get fish, and fish poisoning, the vegetation get damaged. So we mainly depend on processed food, especially rice for our carbohydrates. So I think it's an area that we are trying to address, and we are trying to divert our resources in terms of focusing on prevention. So for the Ministry of Health, what we have done under my office is that we have tried to increase the taxation for sweet and sugary beverages and also food, trying to address that problem as well, so that our people do not fall into that area. But as I say, it's a challenging piece, and we need more literature in the space to see the impacts of the food supply, processed food especially, that we used in for food security. And I think that's a big issue that we can also elaborate and talk or discuss in this forum. But for long-term chronic cases, yes, we provide only mainly palliative care. We support them in the event that our doctors see this is a possibility for the patient to be, based on the prognosis, for the patient to be referred to New Caledonia, which is a French territory, which is our neighbor, about 45 minutes by plane. Then we move them to Medipol in New Caledonia, or we move them to Fiji. Um, Fiji private, especially if they have that capacity to provide assistance. But most often, as I've said, and I think the question very much, NCD is becoming a huge issue now. We have put in a clinic. We call it the National NCD Hub, where we manage all our diabetes patients as well. But those that need dialysis, especially, have been a tough area that we could not manage, so we have been referring them, and that has actually cost a substantial amount of expenses to the government, especially because the government for the people is trying its best to see how we can support those that the health system cannot manage overseas. And for dialysis especially, it's a lifetime commitment, and that's one of the areas as well, to see how we can maybe devise a insurance policy that to manage that expenses going forward.
Yeah, and I think that's kind of like what we're trying to do, isn't it? Together, like we're trying to build that capacity, reach out to other governments, stakeholders, existing health services around the world, how we can collaborate, how we can share resources. I know myself, fiber scans, for example, for screening, there'll be a lot of equipment out there that will be sitting idle. So we want to like bridge that gap. And then from the financial perspective, being able to create funding mechanisms that are based on prevention, which bring a financial return over the long term, because we have to think long term here rather than short termism. Actually investing in clinics and centers of excellence that can provide these complex, shall we say, treatments, and then centralize them, and then have shall we say, sort of smaller clinics, in rural areas, and then focus in community settings to prevent disease, and having these community programs that reduce those costs over the long term, investing in children's mental health and well-being, and even going back as far as, family health and support. So let's take another question here. We have a kind of variant. It says, I don't know the individual's name, but it says, great speech. I was wondering how you see bureaucratic barriers in institution for receiving relief funds for climate change related disasters, the time it takes to receive the funds. That's obviously a big challenge. Your thoughts?
Yes, that's a very brilliant question, and thank you for giving me this platform to address it. It's I think one of the for small islands, the capacity for the paperwork to apply for a funding for climate change, and one I can give a classic example is the one that we are trying to get through UNDP and WHO. There's a combined funding that we are trying to access for. I think it's the paperwork of really meeting all the requirements of the funder before receiving that package. And the people providing the funding expect us to have this kind of a certain type of financial system in place, and we totally understand, it's a requirement for those that provide funding. But I think that is one of the areas in terms of when you are in an emergency, in terms of responding to climate change and people's lives are affected. How do we really not really bypass, but how do we really leverage in a way so that we can, at a timely basis, access funding, and then respond to a certain calamity? And I think the paperwork of it has been a challenge, especially for small islands that we don't have the capacity to really, meet all this requirement, having a certain structure that is desired by the funder in place, so that then we can have receive that funding. And I think there's so many commitments and so many indications that, oh, funding is available. Vanuatu can tap in that, but the paperwork of actually completing all the requirements to get it, it's something for, especially in a country that we have a limited capacity.
Well, I think, look, we're coming into COP28 territory, and I think this is a critical time. Next month there's the annual investment meeting. I'll get the opportunity to speak around investments and health and the alignment. But I think let's just remind ourselves of the funding gap that remains in terms of climate change and what we require. Like, so
Yeah.
you can see on the screen there, there's quite a gap in terms of what's required. Like, we're not talking about billions, we're actually talking about trillions of dollars here that need to
Mhm.
be mobilized. I think we have to be very honest with those who are listening in, and those countries who are vulnerable to climate change. I think we have to make the case, and Vanuatu is leading the way. And I think we really need to focus and get people's awareness and that threshold up, so people understand that a lot of capital, but that also brings opportunities, Sam,
Mhm.
in terms of job creation, new
Yeah.
technologies. You were talking about the paperwork.
Mhm.
Surely in this day and age, we can accelerate that process through a digital means.
Yeah.
And perhaps, as a few final thoughts, you know, could you share the kind of vision you have for Vanuatu in terms of being a leader of this, shall we say, transition that we're going through? The next 20 years, although it's a challenge, it's going to be exciting as well, because there's going to be opportunities, Sam.
Yeah, so our government has really taken this lead in terms of the putting climate change as a priority of government going forward, and we have also, in terms of climate change funding within the recurrent budget, have also provided allocations within Treasury for ministries that to help them integrate their programs with climate change initiatives as well. So I think that's one of the biggest steps that we have seen going forward in terms of receiving funding. In terms of long-term effects of climate change, we have seen our people are slowly trying to see how we can be more resilient, and we have tried our best to also be an example. Apart from plastic, elimination of plastic within the country, we don't use plastics anymore. We are trying our best to also minimize our usage of fuel type generation. So most of the rural areas now you go, especially, I mean, if I talk about clinics, we have solar energy. Houses now we are moving to solar energy. We are trying to depend more on solar power, just so that we can be an example in terms of um, providing some sustainable approaches of our people going forward, in terms of preventing them to spend a lot in terms of fuel energy and other stuff, but also for them to know that for us to reduce our effects on climate change in a global type of setting, we have also come up with measures that really reduces the those exposures. So I think that's one of those a few of the areas that we have done. We have a national plan in place through the Ministry of Climate Change in terms of it guides most of the ministries on how we're going to respond. But as I've said, the long-term sustainability, and you have pointed out a very important point in terms of the funding gap as well. What we give to the given our plans is just a snapshot of what we see in terms of from the short term to the medium term, and for the long term approaches that we would have to sustain our people for a decade or so. That is something that we will really have to sit together with our partners like yourselves and see how we can cost it out going forward, so that our generations do not really face the impact or be affected of the long-term implications of it. So I think that's basically what we have done. And the advocacy, I think one of the things that I've seen is that our people really want to see this being addressed. It's not coming from only people like myself that work for the government, but it's coming from small lobby group, youth communities, women's group, people in the villages, the chiefs and the paramount chiefs. Um, yeah, really voicing it, and they have seen that impact on their life. So they are from that they are motivating it up to the national. So the government has been driving it, and you have seen our prime minister tabled it during the UN meeting
Well,
early this year.
we've had a few comments in just from Ursa and that. Thank you. And also from Lamak, who's listening in. He's joining us in Africa. He's saying it's a big catastrophe in Africa and health is a concern. So I think, just a couple of final words from yourself, Sam, just for those who are tuned in or those who have listened to this webinar. Are you optimistic for the future? COP28 is a big opportunity. I suppose you'll be pushing hard, and we're working, together in terms of trying to mobilize capital to support Vanuatu. Can you share any insights, just final words of optimism?
Thank you, Gareth, and thank you everyone for joining as well. Yeah, so for us, in a small island state, where you travel around, they see on the other side, you really see the impacts of climate change and how it has had on our people and on all our reefs, on our vegetation, and on our livelihood. And it's those moments that you put your head aside and you put on the moral health that without this support, it's the consequences will be very severe, especially for our generations that are coming. And we are losing land that we normally, when I was small, we normally go stand at the reef and fish. Now you cannot. It's already covered in sea. So it's a big impact as a local as well on our seas. And I'm not only speaking for myself. There's some islands in the Pacific that are smaller than us, and they are more affected as well. But Vanuatu has taken this initiative because we have seen the impact as well. And what we are trying to advocate is for all the small island states, not only for us Pacific, but we have our brothers and sisters and our families in Caribbean. They are also affected as well. So how can we all work together and see how we can support them? And I think that going forward, as you have mentioned, how do we consolidate resources? How do we put all our resources together for those that we have small islands that populations under 1 million? How do we put our resources together, integrate some of the approaches, and how can we address it together? So, for example, if we have a resource in Solomon Islands that we can use in Vanuatu, how do we maximize it? Or if we have a support in the UK that can assist us in Vanuatu, how do we maximize? We live in a global community, and I think for Vanuatu, I'm not only speaking as an Ivan, but I'm speaking as someone that is part of the global family, that we all live in this one world. And I think helping us on the other side has a replicating effect in terms of helping others as well, so that we live a good life going forward and for our generations to come as well. If we don't take any actions now and we don't provide a sustainable financing, especially for climate change and health related implications, it will have a big impact, especially not only on the islands, but also people throughout the world as well. So through the support of our Prime Minister, who's tabled that in the highest level at the UN, those of us that are technical are now trying our best to also voice that out, so that maybe during the discussion in COP28, as you have mentioned, we can get good support from all our leaders and our partners. Thank you, Thomas.
Yeah, thanks very much, Sam. Just to finalize, I think there's a couple of questions, we have to put out to the audience and those who will listen to this on replay. How do we communicate? I mean, we've had 35 minutes. How do we translate the damage that's been done at Vanuatu to us sitting here in Europe who are comfortable, who don't see these climate change effects, but it's our actions that are actually affecting the people of Vanuatu. We need to be conscious of that. And then I think we need to be very conscious of the strain on the health system at the moment and the displacement that's going to come from climate change. For example, we will have like sea rise, we'll have a lot of displacement, potentially a lot of people coming towards Europe and, climate migration all over the world. How do we mitigate those circumstances? Because that can bring conflict towards our door, so these are things that people need to be very much aware of, and our actions. How do we reduce the CO2 levels? I mean, I just came back from Munich in Germany. I can share with people, I've seen some amazing technologies around energy transition, around hydrogen, and it was fascinating to see the work that's going on in Europe. But that technology needs to be transferred all over the world. And I'm sure there's technologies in Vanuatu and in Africa and in South America that can be transferred into Europe as well, and vice versa. I think the climate situation will affect everyone. And the health situation will affect everyone. I mean, we see it here in Europe, in the UK. We've 7 million people waiting for treatment on elective surgery, for example. So, and the effects of climate migration will affect service, and we need to support and train more health professionals. That's a fact. But we also need to move towards preventing disease, strengthening health systems, improving people's health and well-being, and then most importantly, creating new and meaningful jobs in these new industries. That's a critical part of this. So I hope you've enjoyed this webinar. Delighted to have Sam with us, and I'm sure we'll be in touch. We'll have more of these. We'll have a follow-up, absolutely 100% in the next few weeks. We'll be in touch. Myself and Sam are working closely. We'll be pushing this agenda towards COP28. And if you have any questions, please do put them in the chat. Sam will share your presentation as well online. And then from myself and Sam, we'll just say thank you for joining us and enjoy your weekend. So we'll end the webinar. Any information you need is on our website, www.wis.world. And thanks for joining us. Thanks, everyone, and good afternoon.